I think the take-home message is for us to be careful about what we do, and not only at the workplace. Very often we get patients in our occupational service of people who had problems back at home. So the lessons which Lenny has told us now not only apply to where we work, but also back at home. With that, may I just call upon the last speaker for this session, which was Dr. Satya Raj, and she will be speaking to us on workplace stress management.
Very good afternoon to all of you. I know that I stand between all of you and the lunch, and I promised to finish my session in about 20 minutes, which has been assigned to me. So it's first food for our thought and safety, and then food for our GI. So let me start off. I'm talking about the psychosocial aspects of occupational health per se today. So let me start off giving an example. There's a 32-year-old doctor, a surgeon by profession, who walks into a clinic and says that he's been having headache, feeling tired, feeling stressed out, and having unrefreshing sleep. And almost working for about 18 to 20 hours a day, which is a little more than usually any one of us could tolerate. Wife says he's getting a little irritable, a little snappy for the few days. So what would be your take-home suggestion? What do you think is the problem with this surgeon? Yes, can I have answers? Yes, overwork and stress. So this is what we are going to look about in the next 20 minutes. As my co-speaker had also initially mentioned, the promotion and maintenance of the highest degree of physical. We've been focusing on this part for the first half of the session. I'm here to speak on the mental and social well-being of workers also to result in total health for work at all. So I am looking into all these aspects, but I'll be focusing mainly only on the stress, shift work and related problems and workplace harassment, which is of recent concern now. So what is stress? Basically, starting from possibly the director or the topmost person in an institution to a class 4 worker who's helping us with our day-to-day work, there is no one who is immune to stress. All of us do experience stress at some point of time. But how do we handle it? Stress is actually an unpleasant or a disruptive sensation. It has a lot of psychological and physical ramifications also. What is work-related stress? When basically the work demands or the work pressure you have is not meeting in place with your knowledge or capabilities for you to perform that work, you end up having stress. Ideally, there is a difficulty in coping with the workplace situation. So, is this so prevalent at all? Do we need to talk about it? Yes, definitely. Because more than 1/3 of workers all over have suggested that they experience very high levels of stress. And a survey suggested that 1/4 of them said that the work was one of their most important stressors in their life as such. So this could be the major cause of turnover or rapid change of organizations, which most of the workers continue doing, and resulting in a lot of psychological and of course physiological dysfunctions also. So there is a difference in the way we perceive stress also. As Mr. Lenny was explaining, it's most commonly complaining with back pain, headache, and you get to meet an orthopedician, a neurosurgeon, and thank God if you find some disc prolapse or some nerve compression, you're done with it. Unfortunate for you, if they don't find anything, you're going to be with psychiatry. So good that you find a cause in one of the investigations done. So men basically experience more of physical strain, whereas women are more likely to experience it as a psychological distress. Scientific evidence suggests that most people working with patients directly in contact with them suffer from significant work-related stress, and that means it's all of us here today. So what could be the causes of stress? Basically, poor communication between us, lack of interpersonal relationships. We're too busy doing our work, not finding time to spend with our co-worker. Role ambiguity. What am I supposed to do? Where is my limit and where do I end? When there are problems with my career development, when I'm not sure about the certainty of my job, or when there's a job insecurity. And of course, the most important thing, what you carry home from your work and what you take back home also, your home-work interface. What could be the effects of stress per se? Basically, its primary effect is going to be on all of us, individuals. It's going to be a work-related impairment which is going to happen in a disruption resulting in sickness, absenteeism, and many other causes. A secondary effect would be definitely on the quality and the quantity of work which is being done. There are multiple models and many people who have tried to look into and studying about what could be the models of workplace stress. Very simple ones, and which I thought would be easy implementing, where one was the person-environment fit. What does this exactly mean? When basically there is a misfit between what proportion of stress a person has and the amount of coping in him. When there is a mismatch in this, definitely there is a stress going to be arising from your workplace. How could you sort of, as all our public health specialists would say, a primary prevention model would be the ideal. Basically, it refers to removing the workplace stressors, which might or might not be possible at certain times. The secondary prevention would basically focus on increasing the awareness, conducting programs that there is something known as workplace stress. Please look into it. Please do take breaks. Please relax yourself and address the coping factors. And the tertiary prevention is, once I have developed it, at least identify and sort of treat the stress-related illness. The next comes into the integrative approach, where it's a more of a holistic approach, where I am trying to see what sort of a person I am, what is the support I have, my psychosocial support, people at home, people in my workplace, my boss, my superiors, and am I a person who's very stressed with small issues and my personality related issues. If I could possibly put everything together, I can easily pinpoint where I have a problem and then try to sort it out. So here again is a small case example which I thought would make things very simple. For example, if I'm a 24-year-old doctor who's walking into your clinic saying, like, I've recently completed my graduation, I have excellent academic records, I'm posted in a busy emergency department in a tertiary care hospital like probably CMC. But unfortunately, I'm not able to function effectively. Why do you think this must be happening so? Yes, basically because I could be a very anxious person. I'd be very highly qualified, but I'm not the right person for the emergency department as such. So this could be the mismatch between the personality as such and the environment. So what could be the manifestations of stress? It could be psychological, like anxiety, depression, tension, boredom. It could be physiological, like increased blood pressure, indigestion and heart rate. It could also be behavioral, by increased alcohol intake, heavy smoking, impulsive work, having problems with family relationships, etc. So management, as all of us have said, first, know to assess the risk, plan a strategy as to how you'll be able to overcome this, implement it, and at the end of the implementation, please do go back and evaluate it and see how well you've been doing the process. So one such measure which I would suggest is the occupational stress inventory, which basically looks into 3 domains. One is your occupational roles as such. What sort of a job are you in and what are the inherent problems with the job as such? A personal strain questionnaire, and basically the resources. What sort of a person I am, how is my coping, and how is my problem solving and things like that. Coming on to the management per se, after saying that there's stress, if I don't tell you how to sort it out, then it's again a problem. So stress reduction strategies, there are personal measures. Of course, there are relaxation exercises, yoga, and many such things which you could do in your breaks. Spend time with your family, have a work and life, family life balance, take vacations. Organizational level, what could be done? Workload is kept in line with the worker's capabilities or abilities. Don't try to overload a person. Provide jobs which are very stimulating, not stereotyped. So I have everything, every day I have something to look up to new. Improve the communications. Provide opportunities for social interactions, get-togethers in your hospital or workplace environments. Introduce a schedule earlier right on so that you're able to plan your other activities accordingly. And of course, work-life balance, as I said, do encourage that. The next part of my topic is again a very important one, is about shift work. As my co-speaker earlier had mentioned, Dr. Alex had told you about what could be the possible outfalls of shift work. This is not to scare you, but to just open our eyes on to look into the possibilities of shift work and its problems and how possibly could we solve the same. So it could result in a lot of chronic diseases. There are multiple evidence-based. I've mentioned a few of them in my slides. You can probably go through them. Chronic diseases like cardiovascular diseases, diabetes, breast cancer have been said to occur more frequently in people who are involved in shift work. So what is shift work? Basically, a 9 to 5 job is the normal job. So anything out of this normal daylight work is called a shift work. It's as simple as that. So it usually affects your concentration, your alertness, your motivation to work. And when that happens, obviously your quality of work is going to deteriorate and the increased risk of accidents and compromising on your safety happens. So what is the biological clock? All of us have a biological clock. For example, we wake up in the morning by 5:30, we need to have our coffee by 6, then we are out for a breakfast by 8, and now I'm sorry, we are slightly delaying the biological clock. We need to have our lunch by 12:30, but it's going to be 1. Fine. So all of us have some circadian rhythm set in us. So when there is a disturbance in this, we do have a problem. So usually the daytime is when we work and the nighttime is when we sleep and usually recover or recharge our batteries with energy to work for the next day. So when the opposite happens, what do you need to do? How do you need to be careful to see that it doesn't hit you? Basically, you could have digestive problems, you could have chronic fatigue, you could have disruption of your sleep patterns, there could be increasing stress in your work, or you could have possibly continuously on night shifts, probably you're going to miss out on your social life per se. So you need to have a tab on that also. So what could be the possible solutions? I know I'm on night duty today, so try to pack up some food for you, avoid snacking, because that's one thing we can effectively do. We can carry it with ourselves. Take adequate rest. About 6 to 7 hours of sleep is definitely essential. And if you're sleeping through the daytime, so then you can probably make this as conducive as this. Our auditorium now currently is dim lighted so that you don't, you can aid sleep. So fix your shift schedules in advance. Take relaxation and leisure exercises even if you get a short break. This is another shift of topic which I thought I'd mention, a quick run through of what is workplace harassment. So as I told you, the psychosocial aspects of occupational health is an overarching thing, and I guess you can have a workshop on that itself. It includes stress, shift work, psychosomatic disorders, psychological related problem behaviors. So it is an endless thing. A short note on workplace harassment. Workplace bullying is now on the increase. It's either verbal, it's physical, social, or a psychological abuse by a person or a group of people at workplace. So how could it be psychological? It's very subtle. Some of us do pick it up if you're emotionally sensitive, some of us don't. In the similar way, some of us react to it, some of us don't. So it could be repeated hurtful marks or making fun, mocking you at work, playing mind games against you, intimidating you in front of others, giving you a job which is absolutely pointless. You know that this is not going to be possible and I give it to you and I say, yeah, why don't you do it? You know that is going to definitely result in psychological harassment. And basically making work difficult for you. If I'm constantly changing your shift, seeing that it's not going to be possible for you, that's again in a way of psychological harassment. What is physical abuse? This word, I don't think it needs explanations. Attacking or threatening with equipments, knives or other objects or weapons. Of course, any sort of harassment in the workplace is going to make you less active, less successful. You do not want to be involved in the work. You get more anxious. You want to avoid work. You get scared. And this is not only at your workplace. The shadow carries on even after that. Even at your work life balance, it gets affected. So you start developing all the physical signs of stress like headache, back pain, sleep problems. It's how the problems initiate and you know you're going into stress-related disorders. Sexual harassment, this is for the completion's sake. I thought I must add it because some of the organizations do have a grievance cell for this and some others who don't have, I guess it's time to make up one. So what is sexual harassment? It's basically an unwelcome touching or sexually explicit comments are being passed. It's either a verbal, physical or visual forms of harassment could be possible. So when this is sufficiently severe or persistent or pervasive in nature, then definitely it warrants a look into the situation. So ideally, let the harasser know about his or her behavior, his or her conduct is not welcomed by you. So then possibly you can go to your immediate supervisor, explain the circumstances, and it's always a good thing to sort of keep a documentation of this process. So as you are doing it, you have a written document to show to your immediate supervisor that this is the problem and you need to sort of represent it. So have a written document, and then probably you can take it to the Human Resources Department and report it. How could you get help in such situations, be it either psychological, physical, or a sexual harassment? Grievance cells organizations, a definite must in most of our hospitals and other such big organizations. Develop written policies and procedures prior to the problem happening. So as I said, a primary prevention model would be ideal. So have a written policies in place. Train both your supervisors and employers at the onset of employment that there are such rights and responsibilities for each one of us, and we need to respect each other's rights. Okay. So I think I'm finishing early so that your GI also has the food early. So psychosocial stressors do exist. Coping is definitely possible. Stress is not something which is not something we can tackle or manage. With very simple lifestyle changes, we could make significant differences in the quality of life we are leading, both in our workplace and at home. So the only key word I would say is early identification and management. Thank you.